Okay, Nick, your next question.
This is also an experiment in democracy right here. And we have lots of questions coming in, including one from the C. Everett Koop of Kansas City, our public health director, Rex Archer. Would you mind standing for us, Dr. Archer?
So you're proposing to eliminate a law before passing something that's better. And I guess that's my concern is, you know, other countries through single payer or other systems have solved a lot of these problems at lower cost and have given access to everybody. They haven't driven people to stop working. And so I guess the question is, why repeal something until you actually propose something that's better?
Okay, thank you. Oh, wow. I've proposed lots of things that are better. And I'm eager to talk about them. I think that repeal probably is not going to happen. I think that one of the advantages of repealing the ACA is that premiums would drop for a lot of people. Premiums would drop for a lot of people who are currently being taxed, hidden tax in their health insurance premiums. When people saw their plans getting canceled and their premiums going up, those were the hidden taxes that were built into this law. You get rid of this law and a lot of people's premiums will come down. Now, there will be people who have high cost conditions, who won't be able to obtain, who will be uninsurable, won't be able to obtain coverage on their own. And I think that, you know, as a political matter, you're not going to get repeal through unless there's some program that is targeted toward that very small problem, very serious problem. Remember, I don't want my kids to end up in that sort of a situation. I want to provide secure coverage to them and to everyone else. So there's going to be, politically, there's going to have to be something put in place to deal with that problem. But at the same time, we can create some sort of program for that small part of the population while building a health insurance marketplace that makes health insurance secure in the manner I was describing before, where if you get sick, your insurance company doesn't have the incentives that it has under Obamacare to avoid or mistreat or dump you, which is what insurance companies are doing. They don't have the incentives to drop doctors from your networks the way that they're doing right now. They're doing that because the more they do that, the more sick people leave their plans and go to a competitor and bring down the competitor's bottom line. And I think the way we build something better after we repeal Obamacare is not by having the government plan it out, because I think we've seen that the government's not capable of doing that. What we have also seen, we saw before the ACA, and we saw it even as Congress was debating the ACA, but Congress ignored it and destroyed these innovations, are innovations that move in the direction that I was talking about, guaranteed renewability. In 2008, United Healthcare rolled out a product called Continuity. Has anyone here heard of it? Do not raise your hand if you're an insurance agent. No one in here has heard of it. This was a product that United said, look, you want health insurance? Come to us. We'll quote you a premium. And if you don't want to buy the policy right then, we'll sell you the option to buy that policy anytime you want, no matter how sick you get. You only have to pay 20% of the premium each month. That is effectively health insurance for 20% of the cost. It does almost everything that the ACA tries to do with its extremely elaborate and oppressive system of price controls and mandates and subsidies. It allows people to buy health insurance at standard rates no matter how sick they get. That was being rolled out right as Congress was debating this law. They totally ignored it. They passed this law and it destroyed that innovation and further innovations that we would be seeing. That's the kind of healthcare sector that I want to see, and it will start to grow organically if we get rid of this law.
Kathleen.
Well, I wish Alan were correct, that organically we would have.
Mike, I'm out.
Oh,
It's okay. No, she thinks I convinced you. No. She could see it on your
I'm
face.
sorry.
That's not a problem.
Alan is correct. I served as an insurance commissioner for 8 years and spent an inordinate amount of those 8 years fighting with insurance companies to try and get people the benefits they had paid for. And I saw over and over again people who were just denied coverage or medically underwritten, which means an insurance company said, yeah, you have a knee problem or a heart attack or you're a cancer survivor, and we're just not going to insure that. Anybody who worked for a large employer didn't have that problem. You worked in the employer, you got in the employer coverage. But if you were buying insurance on your own, you were in the Wild West until the Affordable Care Act. And the portion of the marketplace that it changed was for people buying their own coverage. And it said, never again can insurance companies deny you coverage based on your pre-existing medical condition. You can't be kicked out if you get sick. That was a brand new law, and it was federalized, and it was way overdue because there were way too many folks who were fine until they got sick, until their family member got sick, until somebody had a child who had special needs and they needed to renew that policy because they could be locked out or priced out or dumped out of the marketplace. So the kind of security that is being described is a framework of the Affordable Care Act that was imposed on the slice of the market that didn't have those group rules in place.
Okay, Tarren, I want to ask you a question here. I'll give you a chance to weigh in on this thing. You live in Florida.
And Michael,
I used to live in Florida, and Florida attacked this problem, if I'm not mistaken, in the early 90s. Governor Lawton Childs came up with what were called CHIPAs. And basically what they were is they were going to allow small groups to sort of get together so that basically the underwriting problem was not the one that we had. And then they created sort of a pool of bad risks, which everyone else would then support. Do you recall what happened with that?
Right, in Florida, that market was closed back in the early 1990s. And I think that Ms. Sebelius brings up a point that was a problem in the market in certain states. But the solution to that problem was to blow up the entire system and have everybody who had a plan that they liked, that had lower premiums, they had to get rid of their plan. So I live in one of the top 20 fastest growing parts of the country, in Naples, Florida. Next year, I'm on my third canceled plan for my family. Next year, we have one carrier in one of the fastest growing communities in the country. That's not more choice. That's not guaranteed or flexibility if they're not giving me the product I like. That's complete lack of choice. And that one carrier has, the premiums are twice what we were paying before. So there's this notion of what was intended, but the reality is very different. If the Affordable Care Act had said, here are discrete problems, and let's have very targeted solutions to those discrete problems, I think you'd see a much different response than the approach that Washington knows best, one size fits none, and we ignore the fact that Topeka is over 1,000 miles from Washington, D.C., and we instead say that a bunch of faceless federal bureaucrats are going to regulate what options people in the states have for them.
Nick, there you are.
I'm right over here.
Okay.
And actually came from a National Health Service country. I'm actually 85 years old. I'm not saying that that's a good service. We have a question next from Ron Fugate in Overland Park. Could you stand for us, Ron? Your question, please.
Right. My son is 41 years old. He's developmentally disabled. He has worked for 22 years at a major hotel. And just recently, within the last year, management decided that he's not fast enough and that his hours have been cut in half. He will lose his job at the end of November. Along with that, he will lose his health benefits. Thankfully, he will have the Affordable Care Act that will provide health coverage for him in the absence of the coverage that he loses through his employer. On the other flip side of that, he will have to go in to a community-supported organization for people with developmental disabilities. And in the state of Kansas, there are now over 5,000 people with disabilities waiting to get Medicaid funding to support those services. What do you say to my son, who is under these circumstances really between a rock and a hard place?
I think I would say the same thing I would say to my 48-year-old cousin who lives in Wayne, New Jersey, works at a grocery store there, and is in a similar situation where if he loses his job there, he could lose his health coverage. The problem, the first problem there is that everybody, or almost everybody, 90% of people with private insurance in this country have insurance through their employer. Insurance that has the peculiar characteristic that when you get sick and can't work anymore, in other words, when you need it most, it disappears. So the first thing we have to recognize about your son's situation, my cousin's situation, is that they have been made more vulnerable by the government's effort to tinker with the marketplace.
Why?
Because what created, I know what you're thinking. Wait, this is employer-sponsored insurance. But the reason that 90% of Americans with private insurance have it through an employer is because the government provides a huge tax preference for employer-sponsored insurance, such that an individual can end up paying twice as much for the same or less coverage if they want to buy it on the individual market themselves, directly from an insurance company. Insurance that is more secure than employer-sponsored insurance for the reason that I just mentioned. And yet this is the horse that the government decided to back in the marketplace. No one in their right mind, I don't think, in my view, no one in their right mind would buy, if the government were not influencing their decisions in this way, would choose a type of health insurance that disappears when you get sick and can't work anymore. That's not health insurance at all. So now this doesn't fix your son's problem. It doesn't fix the problem my cousin would be facing if he were let go and lost his health benefits. But it does tell us, is point us in the direction of, or point us away from what is likely to be the wrong answer, which is you don't want to give the people who created this problem even more power to try to fix it, because they'll probably just create even more problems along the way. What I would like to see is, as I mentioned before, repeal of the ACA so that more people can afford health insurance without needing subsidies just because they're being exposed to hidden taxes. There would be some program to provide coverage for people who have high-cost conditions, can't afford it on the marketplace anymore. States would get a fixed amount of money from the federal government so they could do a better job of trying to figure out, all right, who really needs the assistance and who doesn't. Because I'll tell you something, I don't think my cousin needs the assistance. I come from a big Irish Catholic family. He has a lot of people on whom he can rely, his siblings as well as cousins. So if we create an entitlement program that sweeps him up in it, he probably doesn't need to be there. He has other places we can go. And this is part of the problem that I mentioned of people being in Medicaid who don't need to be there. There are a lot of people there. So that I want states to be making these decisions so that if he's not truly needy, he's not going to get a subsidy, and that subsidy will go to someone who does need it.
Kathleen, would you like to weigh in on this?
Well, I would say that Michael's cousin is in a different situation because New Jersey has expanded Medicaid. Their Republican governor chose to move ahead, so your cousin has a range of options. In the situation that was just described, with a person losing a job, he or she now has an option for coverage outside of their employer, where before 2010 they really didn't, unless you could come up with 100% of the cost of your old coverage, called COBRA. You really were out of luck, and COBRA ended after 18 months, so after 18 months you were really out of luck if you had any sort of health condition. I find it very troubling that the notion is that somehow we should have a Sophie's choice of either expand Medicaid or provide resources for developmentally disabled or frail or elderly. That's not the choice. We need to do both. And I know that there may be people who disagree with that, but I think healthcare is something fundamental, that all Americans have a right to healthcare, that if you can afford to purchase it, you should purchase it. You have a responsibility. But if you can't afford that, then there should be an opportunity to access healthcare, which is often a life or death situation. I'm very troubled that in Kansas particularly, the waiting lists for the developmentally disabled have grown exponentially. But that's a choice, unfortunately, that the governor and the legislature make about budget allocations. It isn't that they somehow don't expand Medicaid because that's going to make the waiting list go away. They have chosen consistently not to expand Medicaid, which would actually bring additional resources into the state. So but I think in New Jersey, people do have different options than they do in Kansas or Missouri right now.